Hello, this is Miss Evelyn with the CNN Veterinary Technology program, continuing in BT 1096, Clinical Pathology and Microbiology Part 3 section in Week 2. So Part 3 PowerPoint. And we're continuing on. When we last ended, we had introduced this slide about vet tech or veterinary technology and pathogens. And then I had shown the recording slide because things like large gray, dry mucoid colonies on blood agar plates, BAP, those are all different kinds of notes that need to be on a recording slide or a recording form when you look at your specimens. So continuing on here about enterics. All enterics, and again, these are organisms in the GI tract area, they ferment glucose. They are oxidase negative. Some will produce a gas, CO2, quite often. Some ferment lactose and others do not. And a plate that you can use about that is McConkey's or a MAC, M-A-C, McConkey plate, M-A-C, capital C-O-N, so McConkey plate. And they reduce nitrate to nitrite. So then if you were in a diagnostic lab, that might be a test you could do. Media is used to isolate these organisms are quite often your blood agar plates, your BAPs, your blood agar plate, and your MAC, M-A-C, standing for McConkey, because of that fermenting lactose that is involved in the agar of McConkey plates. You might also see MAC, HEK, H-E-K, or another broth, especially for fecal specimens. Stands for hectoentero organisms, HEK plate, okay? So enterics, but they ferment glucose, and of course lactose is a type of sugar and others do not, okay? So others do not ferment that. So that McConkey plate is a really nice one. This slide has a lot of information on it. Again, the biggest thing to understand is your TSI. This is an I, not a small L. That is a TSI slant, standing for triple sugar iron. That is a slant tube, and you can look at your textbook for a photo identification of that. But it's what we call a slant tube, and it's used quite often for enterics. The other information here about the glucose concentration, acid production, the cap must be loose, 35 degrees centigrade. Now notice, 35 degrees centigrade is a little lower in our temperature incubation than what we normally incubate at for 37 degrees centigrade. That would be a test question, that normal incubation for most microorganisms is going to be at 37 degrees centigrade. All of this other information that's here, the alkaline, the acid, the hydrogen sulfide, glucose only fermentations, glucose fermented and the hydrogen sulfide produced, all of that is there for your reading pleasure and interest. But I would say the only test item on this slide is what would TSI stand for? Triple sugar iron slant, and it's used for enterics because of all the fermentation that ends up happening. And if you think about what the gut is, it's a fermenting kind of area. So know what a TSI, triple sugar iron slant, is. Now we end up looking at our Enterobacteriaceae. So remember, in our opening part of about this, we talked about Enterococcus species, and now we're on the last part of that of Enterobacteriaceae. Again, family. This is a family grouping. Okay. With the Enterobacteriaceae, we divide them into 7 tribes. Don't ask me why they're called tribes. Just know we divide them into tribes. Your streps are divided up into Lancefield groups. That could be a test question. What basic organisms would have Lancefield groupings? That's your strep. And what basic organisms would have tribes? Your Enterobacteriaceae. If you want to know more as to why those terms were utilized, you Google it on Mr. Google and probably find the answer. And again, divisions about this might change as we see different studies about structure of DNA and RNA, but at the time that this PowerPoint was put together, this was pretty accurate information. So again, we have 7 tribes, and we're going to break those tribes apart. Again, if you're doing an outlining, this might be a good spot to say Enterobacteriaceae, 7 tribes, and begin to go ahead and break those down. Tribe number 1, Escherichiae. Escherichiae, the family name. Escherichia and Shigella are your genus names. In a moment, you'll know why we call E. coli what we do, because Escherichiae and Escherichia are kind of hard to spell. Key reactions about Escherichiae. So we're talking about the family for both Escherichia and Shigellas. What the test is called indole positive. Again, you were briefly introduced to various tests last week in the PowerPoint, and in your textbook you will explore some of those in the hands-on lab time later on. But that's why we went through all the material we did last week to give you an idea about when you see something that says indole positive, what does it mean? It means a certain test was done. And again, hydrogen sulfide, negative, and we got a couple other things. So tribe 1, Escherichia and Shigella, and they're indole positive. That's what I would write down. E. coli is what we call them. So Escherichia coli. And we usually do it with a capital E and a period. That's your genus. Coli, species. And there are many of these so like 0157, H7, okay? They break apart E. coli's into subspecies and probably subspecies. Okay, but E. coli is your most commonly recovered clinical isolate, causing an issue. So most strains of E. coli are normal in the intestine, but when they get into around other organs, outside of the intestine through a surgical break, then they can infect other organs. They're gram negative. Again, endotoxins might be produced that can induce shock. So you have endotoxins coming out from the bacteria. Again, with food poisonings, breaks in community care for humans, we see E. coli causing different kinds of issues. Sometimes in swimming pool areas. Don't want to know how the E. coli got there through the kidlets, the children, the dear ones in the swimming pool. And then we have to close the swimming pool down because there's an E. coli breakout in the environment of our swimming pool area. E. coli are most often lactose fermenters, but they're not always, so you could use a McConkey plate. And again, a lot of this other information is here for your information, but they're not going to be a test question about what is 0157 H7, okay? I'm not going to put that down on a test, but I would say, is an E. coli gram negative or gram positive? And what does it look like? It's an coli, it's a cocci, it's a round gram negative organism. Other organisms like Shigella may also produce toxins. And here are more things about E. coli. This is, again, for your information. We call it traveler's diarrhea because in some, especially again, third world countries, their hygiene may not be as good, and people kind of get used to the organisms on their food. But we go down there as American citizens and we don't wash the vegetables properly, and we don't want to know how all those vegetables got to the market, how they came out of the field, or what fertilizers were utilized and how. So we eat the skin of the tomatoes and so forth, and we end up with diarrhea. Okay, and they might have infants with diarrhea. There could be inflammatory diarrhea. There could be mucoid diarrhea that might have blood. There could be chronic diarrhea. So the take-home message from this slide with all kinds of interesting words is E. coli often produces, and everybody can say it with me, diarrhea. Know how to spell that word, D-I-A-R-R-E-A. But E. coli quite often produces diarrhea. It's an enteric. And more about E. coli. You notice there's more words about bloody diarrhea, hemorrhagic colitis, hemorrhagic uremic syndrome. Most common reservoir for E. coli, hecteric, hemorrhagic E. coli, enterohemorrhagic E. coli is cattle, rarely dogs, and horses, sometimes a deer. E. coli can infect animals' other organs or cause septicemia. They can have diarrhea. There can be abortion and early death in horses, neonatal enteritis in newborn pigs, gut edema in older piglets, inflammation of tissue and organs in the poultry. But do you get the picture that with E. coli we can have diarrhea? But you should know that there can be some animals that are a little bit more susceptible. Okay, Shigella. Okay, so this is another one of our enterics. And in this, the grouping of the Enterobacteriaceae, tribe 1, this is tribe 1, is Shigella, S-H-I-G-E-L-L-A. So that's the genus. It causes fever, watery diarrhea, abdominal cramps. You might have, again, community-wide outbreaks, mostly in the summer. Partially of that is we get a lot of community get-together. It might affect young children. Humans are the only natural host for Shigella. And you have Shigella dysenteriae, causes dysentery or bloody diarrhea. So, E. coli produces diarrhea. Shigella causes, quite often, watery or bloody diarrhea. All right. The other items on that slide you do not have to necessarily memorize. We're in tribe 2. Edwardsiella. This is the family name, Edwardsiella. Similar to Escherichiae, except these are hydrogen sulfide positive. So if you were in a lab that could do a hydrogen sulfide test, Edwardsiellia's tend to be hydrogen sulfide positive, and your Escherichiae would be negative. These ferment glucose and maltose, but not mannitol or lactose. So again, they ferment some, but not everything, and different plates that you have may be able to actually show you what is being fermented. Again, in the bowl, Edwardsiella, chief reservoir, reptiles, snakes, toads, turtles, and fish. So these tend to be a little bit more cold-blooded animals, but it can be opportunistic to a human pathogen. So if you had a wound and you're dealing with reptile or snake medicine and you got a Edwardsiella organism into your wound, you certainly can end up with a bad infection and diarrhea. That was tribe 2. Tribe 3, Salmonella, similar to the Edwards-Clia, except this is indol negative. So again, remember the textbook that listed all those different kinds of tests, and now you can understand how you could utilize those to specify or try to come up with a presumptive diagnostic result on an organism. Because if you had a gram-negative cocci, these are all gram-negative cocci, and you ran an indol test and it was indol negative, that might put you into the Salmonella family. Again, these live in the gastrointestinal tract. We have Salmonella typhi, typhoid fever. Humans are the human-only disease. It's not zoonotic. We have Salmonella enteritis, passed in the feces of infected animals or humans, can cause our food poisoning. Salmonella enterica, subspecies arizonae, is found in diseased reptiles in Arizona. So again, if you had a desert tortoise that came to you and it came from Arizona and it was sick, or you got sick after handling it, it may be Salmonella enterica arizonae. And then snakes are a natural reservoir. But again, human and other animals can become ill. So one of the problems that we see here is sometimes in the past, or maybe even still sometimes a current therapy, is what they call snake powder capsules that are used for AIDS patients. Well, if that snake powder was contaminated with Salmonella or Salmonella type bacteria, then our poor AIDS patient in the human world would have some real problems. So understand Salmonella, tribe 3, indol negative, gastrointestinal area, passed in the feces, and reptiles and snakes, again, can be problematic species. More about Salmonella. Some animals are carriers and they shed it in their feces, but they never get sick. Sometimes they'll have a latent infection, and it lies dormant in the blood and the lymph system until they come under stress. So a couple of those that we'll see with stress-related issues can be cattle and horses, especially. Cattle, when they're being shipped off to market, and if there is a Salmonella outbreak, just the stress of being shipped to market might have them break with heavy diarrhea and so forth, high fevers, and maybe a high mortality rate. Okay, adult cattle may develop diarrhea and fever, can cause abortion, and the organisms may also be passed in the milk. Again, horses, mares might have a late-term abortion from it. Arthritis might be there in colts and fillies, okay? Can cause enteritis, inflammation of the small intestine, and again, in equines, any infection is a bad infection on a horse. So you might think Salmonella in the right species might either cause some abortion issues or stress-related issues, and dogs and cats can also get infected and ill from a Salmonella infection, especially if they have other condition going on. More about Salmonella. Fowl, birds, okay, most common source of Salmonella infection to humans. So one of the reasons we have it around the springtime, you have your little cute chickens available, and there are signages at the stores that sell them saying, you know, please wash your hands well afterwards, because indeed there could be Salmonella present in the fowl, in the fowl droppings, and the animals aren't being affected. If you get that there, and think of your little ones, your children come up, your 3-year-old, and they know nothing about keeping their hands out of their mouth, and they become sick with a diarrhea issue. Also, raw or undercooked eggs can cause salmonella infection. And part of that might be if there was an improperly cleaned egg and there was stool, feces from the fowl on the outside of the eggshell, goes into your raw or your undercooked eggs, and you get sick. Turtles have also been a significant source of salmonella, and in some states it's certainly against the law to sell turtles that are much smaller for part of this reason, again, handling them and so forth. Tribe 4, Citrobacter. Citrobacter. Again, similar to your salmonella, but there would be a test called lysine decarbonase negative, okay? You really won't need to spit that on a test, but that is how they differentiate, and these are found in the urine, throat, sputum, blood, and wounds. Citrobacter. So again, knowing the source of where your sample came from, the species and where, can really help your diagnostic lab with figuring out what's going on. That was tribe 4. We're in tribe 5. You notice these are going past pretty fast, but get the main divisions of this. And a couple of those, again, highlighted areas in bold or underlinings. Tribe 5, Klebsiella. Again, family name, Klebsiella. 5 genus are in this tribe. There's a lot of gas produced. They're indole negative. Klebsiella pneumoniae and the Klebsiella oxytocca. One is indole negative, one is positive. Again, I'm not going to have you spit that back on a test, but this information is here to broaden your knowledge and your understanding. Both of these are what we call mucoid bubblegum looking. So when you waft across your plate and you're doing an odor test, again, wafting, W-A-F-T-I-N-G, the colonies smell a little bit like bubblegumish, and they look pinkish, mucoid, like a piece of gum stuck on it. Okay, so they're very mucoid bubblegum color, Klebsiella. They're very destructive, extensive necrosive, with hemorrhagic areas in pneumonias. Very destructive organisms. Sputum from your animal or person might be very thick, mucoid, brick red, or looking like currant jelly. You notice how the terminology is just into normal things that we have around in our eating or kitchen area, and it's a good way to use those kind of terms when we are describing what we're seeing. So Enterobacter can distinguish from Klebsiella from ornithine with a positive because they're motile. So a motility test. And then we have Enterobacter aerogenes and cloacae, common isolates, and again distinguished between by lysine and arginine decarbonate. I'm not going to ask you for that information on a test. But the main thing with tribe 5 Klebsiella is to know that there is this mucoid bubblegum looking organisms in the colonies, and that can be very destructive and extensive necrosive and hemorrhagic causes. Continue with a couple more of the Klebsiella. There is Hafnia, there's Pantoia, and there's Serratia, and these again are not going to be a test item, but this kind of rounds out looking at the different 5 genus that we would be having, okay? So different genus species that would be present. Tribe 5. Tribe 6, Proteae. These are very unique organisms. They're all alanine deaminase positive. Again, probably the test only done in a larger lab. But if you were to run a phenylalanine deaminase test and it's positive, you have a Proteus, Protease, Proteus mirabilis, Proteus vulgaris. Again, an indole test. One is negative, one is positive. So if you were able to do that test, you might be able, and you thought you had a Proteus, you might be able to do a presumptive diagnostic division. Both of these are urease positive. They produce alkaline urine, which promotes formation of calculi. So later on in this course, you're going to be introduced to urinalysis and, of course, calculi, stones, bladder stones. So the urine, if it is very alkaline, it might have a Proteus bacteria present in it that is actually leading to some of the calculi formation. So yes, you can do a smear from the urine. Proteus mirabilis swarms on your blood auger. Again, it is a swarming. I was trying to show it with my little pointer here. It just kind of swarms around. Again, kind of causing waves, almost like the ocean waves against the sand, but it swarms on blood auger. It's not a pinpoint colony. The vulgaris may also swarm. And Morganella morgani can also cause urinary tract infections. It's in tribe 6. And Providencia redgeri is also found in urine. So if I was doing my own personal outline, I would say tribe 6 Proteae. Again, the tribes are in Roman numeral outlinings typically, but tribe 6 Proteae, and I would say swarming quite often, and urine is a good source. Tribe 7, Yersinia. Now you probably were introduced to Yersinia in your disease course last term, zoonotic diseases. Again, this is similar to Escherichiae, except these are urease positive if you were able to do that test. Yersinia enterocolytica, the major reservoir is pigs. Again, that's bold. I would say Yersinia enterocolytica, remember about pigs. An oral digestive route with the infection often occurring in the ileum. Remember, it's important to know how to spell the difference between ileum in the intestine and ileum in the hip, adjacent to the appendix. Can grow in cold. Motility is positive only at 22 degrees centigrade, and it's negative at 36. So if you were to grow this organism in a little colder incubator, then you may see motility, but if it's at 37 degrees centigrade, our normal temperature, you probably won't see motility. Yersinia enterocolytica, pigs. Still tribe 7, Yersinia pestis. So you need to know this organism. Yersinia pestis, again, genus is Yersinia pestis, P-E-S-T-I-S, is your species. This is the organism that causes plague. It is endemic. It is here in New Mexico. We are so lucky about that. I say that in jest. You can have 3 different types of Yersinia pestis infections. Bubonic, which causes enlarged lymph nodes, or buboes, B-U-B-O-S. That was what the Black Death really was. But if it goes into the respiratory tract, you can have pneumonic plague with pulmonary signs, and you can have general septicemic plague with it floating around through the whole blood system. So bubonic with buboes, enlarged lymph nodes. Pneumonic, pulmonary signs, septicemia, sort of systemic signs. The plague, the organism is carried by rodents, transferred to humans by the rat flea or a flea. We see outbreaks when there is a rodent population increase. You can see an outbreak. Again, here in the general area of Albuquerque, New Mexico, Yersinia pestis likes to be present in the rodent area, probably more so around the 7,000 to 8,000 foot area. We don't really see it down in the Rio Grande Valley at 5,000 feet or so, and we may not see it at 10,000 feet on the top of the Sandia Mountains. But it really likes that interim area in the East Mountain areas especially, and animal hospitals in that area are always on the lookout for this. Yersinia pestis, not only is it zoonotic, but it is a potential bioterrorism organism. You are introduced again, I'm sure, to Yersinia pestis plague in your diseases course. Here in microbiology, we call it, it looks like a safety pin diagram. Looks like a safety pin. So it is sort of an oblong, coxy or rod shape, but it's pretty dark staining at the outer edges like a safety pin. It does not like to grow on MAC. So if it grew someplace else and you put it on MAC, you might have Yersinia pestis. Remember that MAC McConkey. Cats are very susceptible to plague and are severely affected by the infection. They can develop all three types of plague, fever, abscess, lymph nodes, and it is really and hemorrhagic pneumonias, encephalitis. It is fatal to about 50% of cats. So cats come in contact with it because they're out hunting around the rodent burrows, and they come in contact with fleas. As they catch their rodents or find a dead rodent, the flea bites the cat, and the cat ends up with Yersinia pestis. And again, a pneumonic plague in a cat can easily pass to a human by the cough. So it is a zoonotic concern. Still in this area is our Campylobacter. We're nearly done here with our slides and our organisms for this PowerPoint. Campylobacter, small curved gram-negative rod. We call it looking like the wings of a seagull, sort of a wing pattern. Almost like you would draw a little picture of a bird, going down, up and down again, a wing pattern. So it's small, curved, gram-negative, so reddish, pink in color, rod shape, but it's not just a rod. It has this what they call seagull wing appearance. It can be a zoonotic enteric pathogen. Dogs, cats, more severe in the puppies and kittens, can cause vomiting, diarrhea. In sheep, it can cause late-term abortion. Cattle, it can have fever and diarrhea. Adult cows, mastitis. Organisms can pass in the raw milk, and the poultries can shed it again in the feces. Your enteric media will be a clear green, okay? But remember that Campylobacter, small curved gram-negative, seagull wings looking rod, wants to grow at a little higher temperature, so it's microaerophilic. It likes to have a little higher temperature and causes abortions, diarrhea, mastitis, a variety of things. And we're up to, I believe, the last slide on this one. We will be ending here with Pseudomonas aeruginosa. A-R-U-G-I-N-O-S-A. Pseudomonas aeruginosa. This is a large gram-negative rod, very similar to an Enterobacteriaceae. But the organism, when it is on blood agar, this again comes down to that recording chart. How does that colony look? This one, Pseudomonas, likes to look green. It is spreading, and it has a very dry appearance. Not mucoid, not damp. It has a dry, powdery appearance. And it smells like corn tortillas or sweet grapes. So again, you can do a wafting test, W-A-F-T-I-G. You get the smell off that, and you say, oh, this smells like corn tortillas, or it smells like grapes. And the organism looks greenish, spreading, and this is very present in wounds, green purulent matter. And again, it likes to grow at a little warmer temperature. So that ends PowerPoint number 3 for microbiology, and we will break it off at this point. Thank you very much.